Hello. It's so lovely to see you today. Can you confirm to me your name and your date of birth? Thank you. Now, you've been referred to me by your PCP, correct? You have been experiencing a little bit of dandruff, and we're wondering if there's a more advanced scalp treatment than just using your regular brand of dandruff shampoo. Now, there are a lot of options available, but I'd like to try a more experimental treatment today because it seems that your problem is a little bit severe, and I want to make sure that we clear all of the dead skin from your scalp, okay? Now, before we get started, I'm going to put on some protective gear. Perfect. That's just going to protect my arms. Excellent. And I'm also going to need to put on an apron. Now, these disposable plastic aprons are very useful for this kind of procedure. Perfect. That's just going to keep me nice and protected. And we are going to do a very advanced scalp treatment for you, okay? I am going to be using a lot of different tools to just remove and cleanse the scalp. I'm going to start by just spraying. Get the scalp a little bit wet and moistened. And then what I'm going to do is just begin by massaging. What we do during this process is loosening, itching. I'm sure your scalp might feel very itchy, and that's okay. This isn't indicative of any health problems. It's a completely normal thing that affects millions of Americans and people all over the world. Good. Yeah, back behind your ears and on the back of your head, it's a little bit uncomfortable, isn't it? But that's okay. That's why we're getting deep in there. You are producing quite a bit of material from your scalp. I'm going to spray it one more time just to loosen. Good. Now, don't worry, this is actually a very satisfying part of my job. There's no need to be embarrassing. It's completely normal and natural. It's just a little skin affliction. And what we're doing is we are taking that skin and just making sure that it's moisturized and free from debris. Good. Now, I was able to get pretty deep in there just with my gloves, but as you can tell, gloves kind of blunt the fingers rather intensely, and I really need nails for something like this. So what I'm going to do is just put on these prosthetic nails so that I can much better get in there and assess the problem. I know they look kind of scary, but look, they're not all that bad. They're just prosthetic fingernails. Not so scary. That feels good, doesn't it? And now I am able to really get more intentional about the depth of exfoliation of your scalp. I'm loosening up so much of this dandruff. I'm going to have to spray your scalp again just to wash it off, okay? And there it goes. It's not so bad. Excellent. You feel a lot more raw. That's okay. The rawness will go away, and then you'll just feel kind of clean and relieved. You might feel a little bit tender throughout this process, okay? That is normal. What I'm doing is intense, and it needs to be intense because I do have a pretty severe condition. That doesn't mean that there's nothing we can do about it. We're going to treat you, and you're going to be completely dandruff-free in a matter of weeks. Probably spent a lot of your life with this condition, and you're probably very tired of having to deal with it. It can be embarrassing, it can affect your life and your relationships, and I don't want that to happen. I want you to be able to live a full and dandruff-free life. And debriding the scalp like this is the first step to that, okay? Do it as gently as possible, but I do need to get this done, okay? So whatever you need to do to get through this experience, I understand. You can close your eyes and take a deep breath. But I am going to remove every little speck of dandruff from your scalp. Good. That wasn't so bad. And that's definitely the most intense part of this process. I'm going to be using this head scratcher on you next to clear away even more debris, okay? Oh, this is working wonders. We're going in order of intensity. We start out with the most difficult treatment, and it'll get easier from here, okay? getting the sides of the head, underneath the back of the head cradle, right at the nape of your neck. That's where you'll notice a lot of dandruff on your collar. And it's where you can't see a lot of the dandruff that's fallen. And where you can't see it, that has the best potential for, an awkward comment or something embarrassing when someone notices that dandruff on your shoulders. Then I'm going to use the pointy end of this. It's blunt, it doesn't hurt at all. And I'm just going to move it around between the hair follicles, exploring every whorl of your hair, your cowlicks, and apart your hair in different configurations. So I can really inspect every quadrant of your scalp, right behind your ears, the nape of your neck, and all the way up to your forehead. Good. You're doing so well. Thank you for trusting me throughout this process. I know that physical things like this can be intense, especially when it's involving something that you might be a little self-conscious about. I don't want you to feel self-conscious, so I am going to really treat every last part of your scalp. And let's spray you down one more time. Good. It's looking so much better already. I'll hold up a mirror for you to see it, but you're going to be absolutely stunned by this result. Now I'm going to use an even finer tooth little comb. This tiny little comb is going to just extract any little hair and skin that might remain. I feel it scraping against your scalp. Comb your hair in all different directions. Okay. Make sure I cleanse every area from the nape to the crown to right behind your ears to in front of your ears. We're going to clear and declog your scalp. Because the thing about dandruff is it's just a lot of debris clogging your scalp. That's going to decrease sensation. It's going to make it harder to really feel feelings of well-being and cleanliness about your scalp. So when I'm done, your whole scalp is going to feel so clean, so completely new. A whole layer of skin, healthy skin, exposed. That's looking excellent. Now that you have this new layer of skin, all of the dandruff is gone. I don't even see one little fleck. What I'm going to do is I'm going to spray a little bit of moisturizer on your scalp. This is going to be the first of many treatments, okay? And then I'm going to just rub that moisturizer into your scalp, all right? So let me rub it into my hands first. Okay, now just relax. I'm going to rub that deep into that new skin, that healthy skin, that skin that's not going to flake, that's not going to give you any kind of trouble. It feels different, doesn't it? It feels almost fresher. Excellent. Oh, you're doing very well. I'm very happy with this result. I think you're going to be also very happy to see what your hair looks like after this treatment. Now, it is possible that your skin could dry out again and start creating more dandruff. But if that happens, what you're going to do is you're just going to book a follow-up appointment, and we can keep repeating this process until the skin on your scalp is completely healed. Understand? Good. I hope that wasn't too uncomfortable. And I apologize if you experienced any kind of sensory feelings because of it, but I think the result is worth the time we put into this, okay? Now, thank you so much for coming in.